So one question that we get asked frequently in clinic is, why do we keep asking about old injuries? And do in fact old injuries matter? And the answer to that is absolutely. And the reason for that is that even though you may have had an injury that would have healed 10, 15 years ago, let's say you broke your wrist 10, 15 years ago, we are still interested in taking a history about that injury. And the reason being is that when we damage something, it doesn't only take time for the structure to heal, but also that information about the healing is also encoded in our nervous system. And what that means is that when we move our wrist, even though the wrist is completely healed now, the nervous system in the brain is still aware that there has been a previous trauma. Now, most of the time that doesn't present too much of a problem. You're aware, or the nervous system is aware of the previous injury, and yet will allow you to move and operate the wrist and hand and the arm and the shoulder completely normally with no fear of re-injury. But occasionally, in just the same sense as you may have previously injured the wrist and emotionally you're aware of the injury and you are perhaps a little bit apprehensive of moving it in the future, so that's an emotional attachment to the injury. We can also have a nervous system sensitivity to the previous injury. And so what that might mean for you is that even though you damaged your wrist maybe 5, 10, 15 years ago, the nervous system, every time you move it, will be sensitive to the movement action. And as a consequence of being sensitive to the nervous system, the brain has to make a decision. And the decision that the brain always makes is, do I move towards a position of protection, or do I move towards a position of efficiency? And when there's a previous threat or a concern that there may be a re-injury, what the nervous system will do is selectively elect to go to a position of protection. And that protection means that you're operating the wrist inefficiently, possibly overusing some muscles and underusing others, which of course means that if you're moving to a position of protection and not efficiency, then you are in a position where you're likely to cause re-injury, either through overuse of the muscles that are overusing or being overused, therefore at risk of getting a tendinitis, or in the muscles that are perhaps not being used well enough that you have a little bit of latent instability in the joint and possibly at risk of creating something like an osteoarthritic change. So in the clinic, one of the first things that we tend to do is take a complete history, not just of the injury that you're presented with, but any injuries that you may have had throughout your lifetime that possibly could give us a key insight into why you're in pain at the moment.